Hello, and welcome to the Patient Care Technician Advising Session at College of DuPage. My name is Mercedes Orrick, Program Chair, and I'll be guiding you through this important information to help you understand the structure, expectations, and opportunities in the PCT program. Upon completion of this video, please answer the questions and submit your answers. When you submit this form, it will not automatically collect your details, like name and email address, unless you provide it yourself. Please watch the full advising session video presentation, and after the video, fill out the form on the webpage and complete the quiz. If you did not score 100% on the quiz, you will not receive credit for completing the advising session requirement and must retake it. Admission questions? Email hsadmissions@cod.edu. Program questions? Email nursinghealth@cod.edu. A patient care technician, or PCT, plays a critical role in healthcare by assisting patients with daily care, monitoring vital signs, performing phlebotomy and EKGs, and ensuring patient safety in hospitals and acute care settings. PCTs provide compassionate, patient-centered care and are vital members of the healthcare team. PCTs are trained to provide holistic care, meeting both technical and personal needs of patients, from monitoring vitals to assisting with activities of daily living. By becoming a PCT, you gain an edge in the competitive healthcare field, setting yourself apart as a highly skilled, multifunctional healthcare professional. At COD, you'll gain hands-on clinical experience with only 2 students placed at each clinical site. This ensures individualized training in venipuncture, capillary puncture, and ECGs. The program is short-term, offered in 8-week or 16-week formats, and prepares you for the NHA Certified Patient Care Technician (CPCTA) exam. PCTs are in demand across Illinois and the U.S., with growth projected at 13% over the next decade. The PCT program is delivered in a hybrid format to support diverse learning styles. You'll complete online lectures and assignments, attend in-person lab sessions, and participate in clinical placements. All 3 components, online, on-campus, and clinical, are required for success. Our curriculum balances didactic content and hands-on practice. Weekly modules will prepare you for practice exams and lab sessions. Your training will focus on high-demand skills including venipuncture, capillary puncture, and ECG performance, as required by the NHA. Online coursework allows flexibility, but it requires excellent time management. On-campus lab sessions are mandatory and give you the opportunity to demonstrate critical skills. In-person clinical rotations are required to meet the NHA eligibility requirements for certification. To be eligible, you must have an active Illinois CNA certification or have completed NERSA 1105 with a C or better within 3 years, completed or be enrolled in Surgent 1000. You'll also need to create a Castle Branch account and submit a drug test, background check, and complete health requirements. You must meet certain motor, sensory, communication, and behavioral expectations, including the following motor sensory capability: move from room to room and maneuver in small spaces, squat, crawl, bend, stoop, reach above shoulder level, use standing balance and climb stairs, lift and carry up to 50 pounds, exert up to 100 pounds force, push-pull, use hands repetitively, use manual dexterity. Sufficient fine motor function, must be able to walk and stand for extended periods of time. Perform CPR, travel to and from academic and clinical sites, coordinate verbal and manual instruction, auditory ability sufficient to hear verbal communication from clients and members of the health team, includes ability to respond to emergency signals, discern soft sounds such as those associated with taking a blood pressure. Visual acuity to acquire information from documents such as charts. Comfortable working in close physical proximity to patient. Communication problem-solving ability. Communication effectively in English with patients, families, and other healthcare providers, both verbally and in writing. Effectively adapt communication for intended audience. Interact. Establish rapport with individuals, families, and groups from a variety of social, emotional, cultural, and intellectual background. Assume the role of a healthcare team member. function effectively under supervision. Sufficient command of the English language in order to read and retrieve information from lectures, textbooks, as well as understanding medical terminology. Skills include computer literacy, function effectively under stress, respond appropriately to emergencies, adhere to infection control procedures, demonstrate problem-solving skills in patient care, measure, calculate, reason, prioritize, and synthesize data. Use sound judgment and safety precautions. Address problems or questions to the appropriate persons at the appropriate time. Organize and prioritize job tasks. Following all HIPAA regulations and COD conduct policies, including behavioral skills and professionalism, follow policies and procedures required by academic and clinical settings. Adheres to COD academic honesty policy per college catalog. Adheres to COD code of conduct per college catalog. Abides by the guidelines set forth in the Health Insurance Portability and Accountability Act, HIPAA, the National Privacy Act. Students must attend all assigned clinical shifts as scheduled, demonstrate safe and professional behavior at all times, perform required clinical skills under the supervision of licensed clinical staff or faculty, meet all preclinical compliance requirements, including health screenings, immunizations, background check, drug testing, and orientation. Completion of clinical hours is mandatory for program progression and eligibility to sit for the National Healthcare Association, NHA, Certified Patient Care Technician, CPCTA exam. The CPCTA certification exam is taken during the final week of the program. Unlike CNAs who focus on basic care, PCTs perform more advanced tasks. You'll complete a minimum of 75 clinical hours in areas such as phlebotomy, ECG, and advanced bedside care. Per NHA requirements, students must successfully perform 10 venipunctures, 5 capillary punctures, and 10 ECGs. These are completed during your clinical placement. You will master infection control and aseptic technique, blood and non-blood specimen handling, ECG lead placement and rhythm interpretation, and responding to cardiopulmonary emergencies. A few key reminders. Only AHA BLS CPR certification is accepted. Marijuana-positive drug screens are not accepted. Transportation to clinical sites is your responsibility. All health and registration deadlines must be followed. Once certified, you can work in hospitals, surgical centers, or private practices. Many students continue their education in programs such as COD's Associate Degree in Nursing, ADN, or other health professions. Be sure to review the PCT registration packet, begin Castle Branch requirements early, and complete your health requirements and chart review. If you have program questions, please email us at nursinghealth@cod.edu. For admissions, contact hsadmissions@cod.edu. Academic advising is available through our healthcare advisors. Need help with program requirements? Contact nursinghealth@cod.edu. Need help with academic advising? Ask for healthcare advisor Lynn Wyrick, wyrick@cod.edu. Tara Hawkins, Hawkins T551@cod.edu. Thank you for viewing this session. Once you finish the video, complete the quiz and submit the form provided on the website. You must score 100% on the quiz to receive credit. If you have questions, we're here to help.